Bueno, en primer lugar, queríamos agradeceros a todos los oyentes por uniros a esta importante discusión y a Cibersalud y a nuestros estimados panelistas por invitarnos a compartir nuestros conocimientos. Mi nombre es Carlos Pardo y yo soy un socio de McKinsey en la oficina de Nueva York y dentro de McKinsey soy uno de los líderes en Norteamérica de nuestra práctica de salud mental y Medicaid. Y está conmigo acompañándonos Kana Enomoto, que es la codirectora del Centro de Beneficio Social a través de la salud de McKinsey, y antes de unirse lideraba la Organización Federal Americana encargada de la mejora de la salud mental y las adicciones en los Estados Unidos. Para facilitar la discusión para audiencias internacionales, Kana y yo presentaremos en inglés, pero estamos disponibles a cualquier pregunta en castellano. Mi compañera Kana compartirá nuestros análisis que estiman el impacto de la salud mental en nuestras comunidades y yo compartiré algunas de las innovaciones que vemos en el mercado. And with that introduction, Kana, I invite you to share some of our research on BH needs in our communities.
Great. Thank you, Carlos. And thank you to Juanjo and all the organizers for bringing us here today. It's really exciting to have this conversation about digital mental health because this is a moment in time that is a game changer. And we haven't seen this level of uptake, and we also haven't seen this level of distress within our generation. So it's no better opportunity to talk about it than now. So first, I'd like to start with our slides. Thank you. So first, I just want to explain what we mean when we use the term behavioral health. When we say BH or behavioral health, we are including both mental illnesses and substance use disorders. So for the mental illnesses, it's depression, anxiety, PTSD, schizophrenia, all the way along the continuum from mild to severe. And for substance use disorders, we're talking about mild to severe dependence on alcohol or drugs, which has the opportunity for both recovery and recurrence. For the remainder of our presentation, when we use the term behavioral health, we'll be referring to both of these conditions, as well as the prevention, treatment, and recovery services that are so important to helping people who experience them. So as Carlos mentioned, we have done quite a bit of research in our Center for Societal Benefit through Healthcare, and this page illustrates how behavioral health conditions impact economic prosperity globally and nationally. So we looked at the economic cost of premature mortality and ongoing morbidity due to poor physical or mental health, calculating the disability adjusted life years similar to IHME and WHO. And what you see here when you break out the impact of mental and substance use disorders by age group, because 50% of mental illnesses occur by age 14 and 75% occur by age 24, these are diseases of the young and they hit people during their prime working years. And then our behavioral health population has about 3 times the rate of comorbid physical health conditions. And the result is we have people with mental and substance use disorders with shorter life expectancies and more years lost due to poor health. And then collectively accounting for about 10% of all disability adjusted life years across all conditions, with then contributing an outsized economic impact because 80% of the years lost are during people's prime working years. And that's driving an economic impact of 2.7 trillion globally and about 42 billion in Spain alone.
Yeah, and just to put that into context, that is about the same as the Spanish government is spending in its entire education program. Just think about that. The amount of money that is wasted and the amount of, because of not having the proper ways to manage and treat these patients is the same as all our investments in education. Of course, the mental health crisis is primarily a human crisis and not an economic one. But the case for investments, when you look at these numbers, is clear both on the human and in the economic sense. Lastly, I would add to this slide that we are seeing similar patterns across LATAM as well. So for instance, the Pan American Health Organization estimates that in Argentina, mental, neurological, and substance use disorders cause 1/3 of all years lived with disability for Argentinians.
So these are challenges that are felt globally, and the impact is widespread. And with COVID-19, and this was before COVID, these are actually pre-COVID estimates. And as we all know, the pandemic has had a devastating effect on us, on our mental health and our substance use. If we could move to the next slide. So the pandemic has created a web of risk factors, right? So millions of lives lost, and the associated grief and loss felt from that. Traumatic stress for those who experience severe forms of the disease, up to 30% of whom are experiencing PTSD. And then the severe stress and trauma for caregivers, both family members and frontline healthcare workers. And we have widespread unemployment and economic instability, which in past disasters, such as the economic crisis in 2008, 2009, we saw incredible increases in suicidality and suicide completions, which so far we have not yet seen in the US, but it'll be interesting to see how those data play out over time. And then massive disruption to our everyday lives, including the toll of prolonged social isolation and quarantine taken on children, on adults, on families and communities. So last year, at the beginning of the pandemic, McKinsey looked at the confluence of these factors. We examined the disaster mental health literature, and we projected that it could lead to an increase of about 50% in prevalence of mental and substance use disorders. Unfortunately for all of us, the observed data reveal that the impact has surpassed our predictions. So in the data coming from the Center for Disease Control in the US, we've seen there are about 3 times more people reporting symptoms of anxiety or depressive disorders than we had seen in 2019. We have about almost 3 times, 2.8 times more individuals reporting suicidal ideation, though fortunately so far we are not seeing a concomitant rise in actual suicide completions. But what we are seeing in terms of increased mortality is a 30% increase in drug overdose deaths. So we're seeing people who, especially during the height of the pandemic, who were delaying going to the emergency room and so were dying at home, who called for help too late. And so by the time EMTs were on site or by the time people arrived at the ER, they had already passed away. It was too late to resuscitate. And then in the United States in particular, we're seeing an increase in access to fentanyl throughout the drug supply, the illicit drug supply, and that is contributing to the devastating losses that we're seeing here. So this moment is absolutely a wake-up call for all stakeholders to talk about behavioral health and bring the discussion of mental health and substance use into their work lives as much as they would talk about physical health. If we can think about as many conversations as we've had about COVID-19 with our coworkers, we should also be talking about the stress and the anxiety, the depression that we're all feeling as a result of the pandemic. Next slide. And so, interestingly, though, I've talked about the increased psychological distress that people are experiencing. We know that there's been an increase in mortality due to some of these issues. And yet, overall, in the United States, we've seen a reduced use of services. But this is the overall number. We know that there's been reduced use of all healthcare services or many healthcare services during the pandemic because people were staying at home and because capacity was being diverted to urgent COVID-19 needs. However, we saw overall about an 8% decrease in insurance claims for mental health and substance use related services in 2020 relative to 2019. In particular, there was a significant drop in services received by children, as well as those kinds of services that are not easily virtualizable, like drug testing, psychological assessments, inpatient care, partial hospitalization. So these types of more intensive in-person services saw a dramatic decrease of use, although we are seeing some uptick now in more recent months. And actually throughout the pandemic, and Carlos will speak more to the virtualized care, but outpatient psychotherapy went down initially, recovered rather quickly, and has been above 2019 levels for most of the last 6 to 10 months, and most recently is about 12.5% over 2019 levels.
Yeah, and just to put that into context, the rest of the specialties are all below pre-pandemic levels. So like PCPs are right now at 3 to 5% below pandemic. So when we say that behavioral health are 12% before the pandemic, that's like 20% higher than if you compare to the rest of the specialties, describing that we are starting to see some increased utilization given the increases in challenges in behavioral health that we are seeing across the population.
Right. Great, thank you, Carlos. So this brings us, so we know that the distress is high, the use of services has dropped in many places, but that people are relying on outpatient help, virtual care. And now we're thinking about returning to work. And this has the possibility of really exacerbating our mental well-being or the mental well-being of many. However, it's important to look at different subsegments of the population because return to work isn't affecting us equally. So a recent consumer survey that we did asked people who had not yet returned to work how they were feeling about going back. And we really saw mixed feelings about the impact on mental health. So about 44% of people said they thought their mental health would decline. This number was higher for people with children and higher for people who identified as Black or African American. And while this about men and women had about the same concern about returning to work, women had a much higher concern or worry that they would lose flexibility to take breaks and set their own schedule upon return. So we know that people are very stressed about the thought of balancing work and their other social roles, because for the last year and a half, we haven't really had, we haven't had the same markers or distinctions. And some of our systems haven't fully caught back up to pre-COVID levels. And so people may be worried about their childcare or their school or their elder care being able to support them as they're trying to balance their responsibilities at work. So it's really important to think about how this is going to affect people's engagement as well as their productivity. And people are already saying that they're about 3.5 times less likely to be engaged at work. And so this is an important factor for employers to think about. And then I would say the one group, however, that is most looking forward to getting back to the office is Gen Z. So here we have a distinction, for millennials. Most have a large proportion who think that getting back to work is going to be distressing. But Gen Z, about 41% say that being back in their pre-COVID workplace will improve their mental health. So it's an opportunity for employers to really take a targeted approach to facilitating that return to work. It's great for some people, it's less great for others. People are really concerned about losing that flexibility. And with that, I will hand it over to Carlos.
Thank you, Kana. As Kana highlighted, the need for behavioral health interventions is big, and it's increasing. As the impact of behavioral health issues are more profoundly felt in our societies, stakeholders are increasingly stepping up to take action. In fact, the level of responses to the crisis from many of these stakeholders has been unprecedented. There are 5 major groups that are leading this innovation. First is employers. The second one is innovators, and think here startups, investors, app developers. We'll cover those 2 in detail in a bit. In addition, we have consumers and families, and consumers are increasingly taking more ownership of their mental health. Just for instance, in the US, now 10% of the population use self-help apps like Headspace or Calm, and most intend to use them after the COVID-19 pandemic. We have payers and providers who are launching new programs to enhance access, provide more clinical services, or investing in internal behavioral health capabilities like like analytics to identify needs, etc. And lastly, we have the policymakers with increasing financing of behavioral health services, easing access to providers through funding, education support, or easing prior restrictions on how and from where psychiatrists can deliver care.
From a policy point of view, just to add, we've seen a lot of progress on behavioral health, and where a survey by the WHO shows that governments, 90% of countries have included mental health and psychosocial reports in their COVID response plans. I think that's incredible progress. And the United States, the Substance Abuse and Mental Health Services Administration has had its budget tripled to $14 billion in 2021, fiscal year 2021, to help address the mental health impacts of COVID and to build the infrastructure.
Thanks, Kana. Next slide, please. So let's talk about employers next. Most of the employees that we talked about or surveyed are taking action. Some from a survey that we did with around 1,000 HR executives or senior executives in organizations, 9 to 10 of them reported that COVID-19 was having an impact in the productivity and mental health of the workforce. 60% were launching new services to increase access to care in mental health, and around 40% assigned a leader that was going to be accountable for the mental health of their workforce, typically a very senior leader in the organization. Next slide. However, many employers are taking action, but it's not been enough to be reflected on the perception of the employees. On a national survey, we found profoundly different perspectives between the employers and the employees on the quality and extent of their support programs. For example, 3/4 of employers believe that they are supporting mental health well or very well for their members, but only 1/4 of employees find these programs of quality. And 30% of employers are focusing on improving access to mental health services, but 70% of employees with mental illnesses indicate that they still have challenges accessing care. And lastly, although 4 in 5 employees share that anti-stigma campaigns would be needed for their organizations, only 1 in every 5 employers have implemented such campaigns.
And Carlos, oh, sorry, I was just going to add that one statistic I find particularly startling is that among people who have a mental health condition or substance use condition and are employed, only 1 out of 10 describes their workplace as stigma-free. So 90% of people with BH conditions are experiencing some level of stigma in their workplace. So you can imagine how that affects their ability to bring their whole selves to work.
Thanks, Kana. Next slide. So what can organizations do? Getting workforce mental health right takes work. It's a journey, and regardless of where each organization is, all of them can make progress in that journey. Let me share 5 actions that any organization can take. The first one is making mental health a priority from the top, a priority that emerges from the C-suite and goes down to the front line. The second one is enhance mental health supports, either through added benefits or internal initiatives focused on the workforce. Number 3 is communicate those supports clearly and frequently. Number 4 is cultivate that inclusive culture, where acknowledging mental health as a challenge is not taboo or poorly seen, but acknowledged and respected as any other physical illness would be. And number 5, measure and hold accountable leaders for the progress against the mental health goals that they've set up in the organization. Some examples of what we've seen organizations do in this space. For instance, Google launched a digital sleep improvement program across the organization. And they've seen results of getting up to 2.7 hours of sleep per week additional to before launching the program. Just imagine that. 1/2 an hour more of sleep for every employee every day of the working week. Another company, for instance, Facebook, they launched a project called Open Up Initiative. where employees could share their experience in internal channels and videos, etc., about how it was to have a mental health issue and how it was accessing those care. And hundreds of employees on Facebook have participated in that program, including senior leaders of the organization, letting their colleagues know that it's okay to have and talk about their own mental health challenges. Next slide, please. The other stakeholder that is taking bold actions in the last few years are investors. We've seen a pronounced uptick in investments in the digital health space for mental health, with the number of mega deals, and that's ones that are more than $100 million, increasing dramatically in the past 2 years. In 2020 alone, we saw 40 of such mega deals. That's like one deal a week since the start of the pandemic. And in 2021, that number is expected to be up. Just in the first 3 months of the year, we saw up to 2 deals a week. In fact, mental health has been the funded specialty, the specialty that's been most funded for innovations and startups in the US for 4 years in a row. Just think about that mental health innovations and investments are getting bigger than high-cost specialties like oncology and high-volume specialties like primary care. I think anecdotally, I think Kana and I maybe spent, we have requests from private equity firms or investors trying to understand the space 2 or 3 times a week. Even as today, we had 2 of those calls. And next slide, please. And what is driving that increase? A huge underlying driver has been the high utilization of telebehavioral health services during the pandemic, which shows higher levels than the rest of the specialties and higher stickiness than the rest of the specialties. And when we survey users of these technologies, most of them plan on using them after the pandemic, whereas the use of other of telepsychiatry in other specialties has been winding down. And it's not surprising. For some patients, particularly those with mild and moderate mental health needs, telebehavioral health is helping them get access in many ways. It's obviously more convenient for many members, but also it breaks the barriers of getting started on that care for the first time. It's easier to go into your room, lock yourself, and start a video conference than it is to go into a mental health facility for the first time if you've never been exposed to that world. And lastly, telebehavioral health has provided access to communities where access before was challenging. In the US, for example, most of our counties don't have one single pediatric psychologist and psychiatrist in the whole county, making access for children with mental health issues extremely challenging if you're not in a highly populated area. Next slide, please. And where do we see these investments in digital health for mental health focusing on? We see 3 major themes. The first one around reimagination access for patients. And here we have platforms to connect members to telebehavioral health. So think Talkspace in the US or eHealth for Telefónica in Spain. I think Julio will talk about that in the next couple of presentations. And also apps that help patients find psychiatrists or psychologists that fit their needs the most based on their diagnosis, their sexual orientation, their race, their ethnicity, etc. And then it helps connect those patients with those providers. The second major theme are access alternatives. And here we see both self-help solutions, so apps that allow members to take care of their own journeys, like Headspace or Calm, or more complex procedures like digital therapeutics. And the third theme are provider enablement, so technologies that help support providers collaborate within each other, helps providers have on-site teleconsults with behavioral health specialists if you're a primary care physician, and also analytics that helps both insurers and providers identify where are the most needs in the populations. Kana, over to you. I think you're mute, Kana.
Thank you, Carlos. So in summary, we believe in the future, behavioral health systems will deliver new levels of access, quality, experience, and affordability. Through our power and our resources as healthcare leaders, we can build a better future through the use of technology by relying on science and thinking about how to get people the care that they want, when, where, and how they want it, whether that's at home, at work, at school, and by being inclusive, focusing on whole people, the whole entire spectrum of their health and social needs, and finally, including the voices of people with lived experience. So we invite you to use this QR code to explore our vision of the future of behavioral health. In this video, there's 3 vignettes where we compare how BH care is experienced today and what we think it can look like in the future when we take an integrated, comprehensive, tech-enabled, and inclusive approach to whole person care. Thank you very much for listening with us today, and I look forward to the conversation.